So there were a few things here that I hope you managed to pick up on. The 52-year-old man who comes into your pharmacy does not have a high temperature, so flu is unlikely. He has a history of COPD or chronic obstructive pulmonary disease, so we need to get a little bit more information from him. How is his shortness of breath? Is it getting worse? Is he using his inhalers more? And if it is getting worse, or he is having to use his inhalers more, then we would need to refer to the GP. He also has a history of high blood pressure or hypertension, and therefore we cannot recommend a decongestant or ibuprofen, because the decongestants can increase the blood pressure, and also ibuprofen or non-steroidal anti-inflammatories can cause fluid retention, which in turn can increase blood pressure. He's been feeling achy since yesterday. There is no mention of any worsening symptoms, so I think it will be safe to recommend something like paracetamol, maybe a lozenge to help with the sore throat. You'd need to be careful with combination products because a lot of them contain caffeine, and that caffeine can also increase the blood pressure. Moving on to sore throat, they're often associated with colds, influenza and coughs, but can also occur on their own. They're mostly caused by viral infections and are self-limiting, normally about 7 to 10 days. Only 1 in 10 are actually caused by bacteria, and even if it is bacteria, antibiotics are not always required, but you should, in those cases, you should refer to the GP to make a decision. Clinically, it can be difficult to tell whether it is viral or bacterial. Generally, if it's red and inflamed, it's more viral, and if there's white plaques, then it could be bacterial. Going through our 1 questions, who is it for? So streptococcal throat infections are more common in children of school age. What are the symptoms? Is there any white or pus patches which might indicate a bacterial infection? Can they swallow? Is there any hoarseness of their voice? If the throat is very painful with no cold symptoms and it's been longer than 24 to 48 hours, then it's best to refer. How long have they had the symptoms? So most sore throats will clear up in 7 days. Is the patient taking any medication? So some steroid inhalers can cause oral thrush, which might give a sore throat. Also, some medication can affect or suppress the bone marrow, so things like carbimazole, methotrexate and azathioprine. So we need to check what medication they're on, and is there any medication that might have contributed to the sore throat. So thinking about our differential diagnosis, so what other things, these symptoms could be caused by something else. What other things do we need to consider? Tonsillitis, this is inflammation of the tonsils. It's usually viral, sometimes bacterial. Nice to have a scoring system which can be used, and it takes into account things like presence of tonsillar exudate, are there any tender neck glands, and is there a fever present? And depending on what that score is, depends on whether people should have antibiotics or not. Quinsy is a lot more severe. There is a collection of pus which usually requires intravenous antibiotics, and in particular people may not be able to swallow very well. Laryngitis, inflammation of the larynx or the voice box, can produce a hoarse voice. It's usually secondary to a viral upper respiratory tract infection, but if somebody's had a hoarse voice for more than 3 weeks, it could indicate laryngeal cancer. Glandular fever is caused by the Epstein-Barr virus. It causes swollen glands, a fever, sore throat and fatigue, and can last several weeks and is common between 15 to 25-year-olds. Could it be a carcinoma? So carcinomas can develop in the throat and also on the voice box or tonsils. So a persistent hoarse voice or any lumps or swelling in the neck, persistent cough or sore throat, unexplained weight loss, and rarely shortness of breath are things that we need to look out for here. Oral thrush is commonly associated with recent courses of antibiotics and also use of steroid inhalers, and this will produce white patches in the mouth and also in the throat and on the tongue and gums. It could be due to a side effect or adverse effect of medication. So as we've already mentioned, inhalers causing oral thrush and sore throat. It might be that the patient isn't actually using the inhaler properly. And some medications such as carbimazole, carbamazepine, mesalazine, sulfasalazine, ACE inhibitors, and also penicillamine can cause sore throats. So we need to refer if there's any hoarseness of the voice, if there's any dysphagia or difficulty in swallowing, that could indicate something like quinsy or maybe a blockage due to cancer. Ask if they can eat and drink okay, and are they able to take medications okay for any other medical conditions that they may have. Is there presence of white spots in the throat? Are there any mouth ulcers? Is there trauma from dentures? Do they smoke? And also capsular sarcoma can produce this sort of effect. If there's any sputum, what colour? If there's any coloured sputum, this will need referral. Any thrush in the oral area, and also if it's a treatment failure, recurrent infection, or if the temperature is above 38 degrees. What can we do to help? We can offer oral analgesics, so something like paracetamol as a first line treatment. Aspirin you can gargle with dispersible aspirin, and it has more of a local effect. Use of ibuprofen and aspirin should be avoided in those under the age of 16, and this is due to risk of Reye syndrome, which can cause liver problems and also swelling of the brain. There are several mouthwashes and sprays available. They are absorbed through the mucosa, reducing pain and inflammation. A local anaesthetic is useful if swallowing is really uncomfortable, but we need to limit that to 5 days as it can cause sensitization with prolonged use. Demulcents soothe and moisturize the throat, but they can have a high sugar intake, and there's also lozenges as well. So we're back in your community pharmacy, and a woman that comes in with her 14-year-old daughter asking if she could buy some dispersible aspirin as she has a sore throat. After going through your WAM questioning, you can see that her throat looks a little red. She has had the pain for about 2 days. She's got mild asthma, for which she uses inhalers. She hasn't tried anything yet for her throat. What do you think are the next steps you should take? And we'll go through this in part 3.